Hi, I'm Rosanna DeRosa, and I'm an addictions counselor at the Vita Nova Foundation. The people I work with often find it difficult to live in their own skin. In particular, they have a hard time coping and managing their inner worlds, whether that being their thoughts, impulses, or emotions. Specifically, they find it challenging to emotionally self regulate and have been emotionally dysregulated for a great portion of their lives. For many, their inner pain and inner conflict is so excruciating, it feels like they want to run, that it's too big for them to handle on their own. So they engage in what becomes habitual addictive behaviors as a means to mood alter and self medicate, to feel a sense of normalcy and to soothe their inner struggles. As a result, they often turn to substances of abuse such as alcohol, cocaine, methamphetamine, opiates, and other self harming addictive behaviors such as eating disorders or gambling as a means to help them cope with life. That is, they learn to emotionally regulate and self medicate in a maladaptive and unhealthy way, which further causes a whole host of negative consequences and harm to oneself and others, as you may already know and have experienced for yourself. All substances, alcohol, meth, cocaine, opiates, are all painkillers. So the real question is not why the addiction, but why the pain. So, what's really going on? What's happened to them? So, the real issue is why are these individuals who are substance use dependent normally emotionally dysregulated to begin with? Again, research has shown the majority of those who struggle with addiction have experienced traumatic experiences in the past. Approximately 67%, and we think that number is underreported, so it's actually higher. So, experiencing consistent and prolonged stress, especially in childhood and adolescence, may create self emotional regulating issues and a struggle in dealing with stressful things in the present. When exposed to repetitive crisis, our arousal levels they begin to rise, and hyper and hypoarousal becomes the constant state. This becomes their new normal. This in turn influences the positivity and negativity on which how we deal with conflict. Research has shown that those who have experienced trauma have quite a narrow window of tolerance. That is, they are easier to anger, become frustrated more, are more prone to becoming anxious, have more difficulty focusing, or the reverse of being more prone to shutting down and dissociating or becoming numb, or having a yeah, whatever kind of attitude, or they might fluctuate between the two. When in these two states, they are more likely to compulsively use coping behaviors such as substance use, self harm, or even this increases suicidal ideation. So the issue is more about helping people to feel safe in their own bodies and tolerate the presence of uncomfortable emotions that sometimes feel too painful for one to bear on their own. They may not have learned to regulate their emotions, which can disrupt their nervous system, finding themselves overreacting to small stresses in the present. Life's everyday events can begin to feel like huge threats. This means that it may be harder to stay calm and focused, and you may be more easily thrown off balance. To explain this, it will be useful to talk about a simple and practical tool to help understand emotional regulation called the window of tolerance, developed by Dr. Dan Siegel, and explore why individuals with substance use dependency are in particularly normally self-dysregulated. It is normal that every day our emotions go up and down depending on what's going on within us or outside of us. This is due to internal factors, things happening in our inner world, like anxieties or worry, or it could be like things going on externally, maybe a conversation you had with someone or feedback you received. Emotions will naturally fluctuate, of course. Someone who has good self regulation has the ability to keep their emotions in check. They can resist impulsive behaviors that might worsen their situation, and they can cheer themselves up when they're feeling down. They have a flexible range of emotional and behavioral responses that are well matched to the demands of their environment. Being in the window of tolerance is the optimal place to be. This is where you're just feeling right, where you're feeling your best and able to cope and manage with life. You're in the window when you can access both emotions and logic. You can clearly think. You're calm, cool, collected, and connected. You feel safe. Things are okay. You are calm but not tired. You're alert but not anxious. When you haven't been supported or can't regulate emotions, and you're having a heightened reaction to stress, you may experience a hyper or hypoarousal response. So how do you know you're in hyperarousal response, also known as flight or flight? You might feel anxious and overwhelmed. You can react with anger or have aggressive outbursts. It can feel like you're constantly on alert to danger, not in a tiger about to attack you kind of way, but instead you may battle with negative, intrusive thoughts, become really critical of yourself. You might have difficulty sleeping. You're on alert. In hypoarousal, which is also known as the freeze response, you might become disconnected from the present. You might withdraw or isolate, sometimes disconnect from others. It's a feeling of being shut down. You can feel extremely zoned out and numb, both emotionally and physically. You lack motivation and feel depressed or nothing at all. A sort of apathy, indifference, or a not caring kind of attitude, just low. You may experience hyper or hypo in response to different triggers. Our clients are best able to cope with stressors and triggers when they are operating within their window of tolerance. So our goal is that we want to try to stay within our window of tolerance. Though it's normal in life that we go up and down, but we don't want to spike up to the top, which we call hyperarousal, which is when we get into that anxious mood and we're in that fight or flight response, but we also don't want to dip down too low to the bottom, which is where we go into that hypoarousal, which is that freeze response, which is a depressive low mood and lacking motivation. So we need to help find new strategies to cope and help us stay within that window when we become aware of us leaving it. The key is to managing these states is to stay within our window of tolerance. It's about self-awareness, self-care, and self-soothing. It's about turning inwards and noticing when we're leaving our window and knowing when to step back and practice an intentional and purposeful behavior to bring us back to that calm, relaxed state. So we're back online, so to speak. You can learn and try different techniques to help you when you're feeling like you're leaving your window of tolerance. Building a toolkit and using these strategies with regular practice, even when you're not triggered, can help you widen your window. It is important to become skillful at making non-addictive behavioral choices. So this is where mindfulness comes in. Mindfulness is all about attention training. It is about being present in the here and now and just noticing how you're feeling in response to something and tuning into yourself with curiosity rather than criticism. Mindfulness is the gateway to change. We cannot change something that we don't acknowledge. And by paying attention on purpose, one can disrupt an unhealthy thought or emotion that we recognize that doesn't benefit us any longer. We can deliberately choose to go in a different, healthier direction, which is usually a kinder, more compassionate, and more caring way of being towards oneself and others. It's a way to self-soothe and help to turn down the volume on intense emotions that tend to cloud our judgment so we can proceed and make wiser, more efficient decisions instead of ones we'll regret. We're learning to pause, think, and feel before acting out, and developing the ability to experience discomfort without self-medicating and using harmful addictive behaviors. So what's stressing you out most days? Maybe it's worry or anxiety when things in your life seem to be piling up, or you feel overwhelmed and the stress begins to rise like a thermometer. This is your opportunity to pause, and maybe instead turning toward it, going inwards, noticing it is the first step. Remember, even saying something to yourself like, isn't it interesting that I'm feeling anxious right now? As Dr. Siegel says, naming it is taming it. It is the first step in trying to manage it. Remember, you can't change something you don't acknowledge. Now that you have acknowledged and noticed your emotional inner state, that creates a pause and a space. And in that space is your opportunity to choose and add a new behavior to make a positive shift. One mindful strategy I like, which is soothing and helps to shift your internal state, and like changing a station on the radio, is what some people call the 5-4-3-2-1. It's using the 5 senses to connect with the present. You name what are 5 things you can see, what are 4 things you can hear, 3 things you can touch, 2 things you can smell, and 1 thing you can taste. Try it and see for yourself. It works every time. Or soothing using your senses, which is unique to you. For example, listen to calming music or an inspirational, motivational video, or watching something funny if you're on the low side. Having a hot cup of tea, looking out the window and capturing the landscape, or soothing yourself with a blanket. The sky's the limit. Find what works for you. Breathing is another really effective option to change your undesirable internal state. Using deep breathing to ground you reduces the fight or flight response and brings you back to yourself and back into your window. Try breathing in through your nose for a count of 5, hold 2 seconds, and breathing out for a count of 7. Doing this a few cycles, this will certainly calm you. Physical activity can really shift your energy and regulate your arousal levels. If hyper, maybe doing something vigorous like a vigorous exercise to help you purge that anger or that overwhelm, or some gentle stretching or going for a walk can really help you bring you back to that calmer, more comfortable emotional place. There are so many tools you can learn and have in your toolkit to help you self-regulate and keep you in your optimal window where you can be the best version of yourself. This again is going to require you to pause and connect to your inner world and choose a healthier way to cope with emotional discomfort so you can keep moving towards life goals or the task at hand. You don't need to become stuck in certain emotions which can keep us stagnant, ineffective, or miserable for that matter. Here we say, if nothing changes, nothing changes. So start by being more patient, loving, and compassionate towards yourself so you can start developing a new, more nurturing and caring relationship with yourself and your inner world. Start exploring what can work for you as part of your day-to-day managing. There's tons of ideas online. I want to end with one of my most favorite quotes by Viktor Frankl. Between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom. Okay, that's it for today. I hope you feel better so you can live better. So remember to be kinder to yourself and be well. Thank you.